You often eat whatever food is available without thinking about whether it is helping or harming your body. Most people never stop to ask how the foods they eat every day affect their health. By the time the effects become noticeable in old age, the damage may already be done, leaving only regret. Today, I'll share 7 important mistakes people over 60 make when eating eggs. Some common habits and myths surrounding eggs may do more harm than good if you are not careful. For example, many people believe eating eggs at night is harmful, while others experience discomfort because they don't stay properly hydrated. There are many misconceptions like these that have become increasingly popular, and it's important to understand the facts so you can make healthier choices. They told you an egg a day was a ticking time bomb. They were wrong, and being wrong about eggs has caused more harm to seniors over 60 than almost any other piece of nutrition advice in the last 50 years. But here's the twist nobody wants to admit on either side of this argument. The egg itself isn't the danger. The way most people over 60 are eating it, without a second thought, absolutely can be. Stick with me, because by the end of this video, you'll know exactly which habits around this one food are quietly working against you. Let me start with a number that surprised even me when I first read the study. Researchers from Monash University tracked 8,756 adults aged 70 and older for nearly 6 years as part of a major study called ASPRI, and they found something remarkable. Older adults who ate eggs somewhere between 1 and 6 times a week had a 17% lower risk of dying from any cause, and a 29% lower risk of dying specifically from cardiovascular disease compared to those who rarely or never ate eggs. 17%, 29%, those are not small numbers, and they directly contradict decades of advice telling seniors to fear this food. But buried in that same data was a warning sign, a detail almost nobody talks about, and it's connected to mistake number 1 on today's list, the one I consider the most surprising of all 7, because it has nothing to do with the egg itself and everything to do with what surrounds it on your plate. I'll come back to that in just a moment, so keep watching. Before we dive into the full list, I want to ask you 2 things, and this isn't just me filling time. First, tell me your age in the comments below. Second, tell me honestly, how do you usually eat your eggs? Fried, boiled, scrambled, or maybe you've been avoiding them altogether out of fear? I read every single comment on this channel personally, every one, and it genuinely shapes the videos I make going forward. So take a moment and type your answer before we continue. My name is Dr. Riyan, and I spent close to 3 decades practicing internal medicine, much of it focused on cardiovascular and metabolic health in patients over 60. I want to be completely honest with you. The nutrition world has swung wildly back and forth on eggs for half a century, and that whiplash has left a lot of seniors either terrified of a perfectly good protein source or eating it so carelessly that they're missing the real, more subtle risks hiding in their habits. Today, I'm going to walk you through 7 specific mistakes people make with eggs after 60, counting down from 7 to 1, from the most minor to the most consequential. And I promise you, several of these will surprise you, because they're not what the headlines usually warn you about. Before we get into the list itself, I need you to understand something about what happens to your body after 60 that changes how every food, including eggs, actually behaves once it's inside you. As we age, especially past 70, our bodies experience something called anabolic resistance, which simply means your muscles become less responsive to the protein you eat, needing a larger, more concentrated dose to trigger the same amount of muscle repair and growth that a smaller amount used to trigger in your 40s. This directly feeds into sarcopenia, the medical term for the progressive loss of muscle mass and strength that accelerates with age. And by the age of 70, many people have already lost a substantial percentage of their peak muscle mass. At the same time, your body is dealing with a slow decline in immune efficiency, sometimes called immunosenescence, meaning your immune system responds more slowly and less powerfully to threats like bacteria than it did decades earlier. And underlying nearly everything related to aging is chronic low-grade inflammation, a quiet, persistent activation of your immune system that interferes with how efficiently your cells function. Every single mistake on today's list connects back to one or more of these 3 processes, which is exactly why I chose them. Let's begin the countdown at number 7. Mistake number 7, and the one I consider the mildest but still worth fixing immediately, is cooking your eggs the exact same way every single time, almost always frying them in a generous pool of butter or oil. Here's the dramatic reality. It's rarely the egg causing cardiovascular strain in these cases. It's the cooking medium. A large egg contains roughly 5 grams of fat, but when you fry 2 eggs in a tablespoon of butter, you can easily double or triple that fat load, and a significant portion of it becomes saturated fat, the type most strongly associated with raising LDL cholesterol, often nicknamed the bad cholesterol, because of its role in building up plaque inside your arteries. For someone over 60, whose arteries have often already accumulated decades of wear, adding this extra saturated fat burden daily, sometimes twice daily, quietly compounds cardiovascular strain over years without a single obvious symptom until something serious happens. Why does this matter more specifically as we age? Aging arteries lose some of their natural elasticity, becoming stiffer, a process influenced heavily by chronic inflammation. Think of a young, healthy artery like a flexible garden hose that can expand and contract with pressure changes. An aging, inflamed artery becomes more like an old, rigid PVC pipe, unable to absorb pressure surges the way it once could. Piling extra saturated fat onto an already stiffening system, meal after meal, year after year, is like repeatedly overfilling that rigid pipe past its comfortable capacity. The fix here is refreshingly simple. Poach, boil, or scramble your eggs, using a small amount of olive oil or a light non-stick spray instead of butter, and vary your cooking method throughout the week. For a synergy tip, pair your eggs with a serving of leafy greens like spinach or kale cooked in the same pan, since the vitamin C and plant compounds in leafy greens have been shown to help offset some of the oxidative stress associated with cooked fats, essentially acting like a buffer against the wear and tear that high-heat cooking can generate. Now let's move to mistake number 6, and this one genuinely surprises most of my patients because it's the opposite of what you'd expect. Mistake number 6 is fearfully avoiding the yolk entirely and eating only egg whites or a processed egg substitute, believing this is automatically the safer choice. A clinical trial comparing whole eggs to a yolk-free egg substitute in people with metabolic syndrome, a cluster of conditions including high blood pressure, elevated blood sugar, and unhealthy cholesterol levels, found that the group eating whole eggs actually showed a more favorable pattern of cholesterol-carrying particles in their blood, along with better insulin sensitivity, meaning their bodies used insulin more effectively, compared to the group eating only the whites. Here's why the yolk matters so much for an aging body specifically. The yolk contains nearly all of the egg's choline, a nutrient your liver and brain depend on heavily, and research increasingly links adequate choline intake to healthier cognitive aging. The yolk also contains lutein and zeaxanthin, 2 antioxidants that concentrate specifically in your eyes and help protect against age-related macular degeneration, one of the leading causes of vision loss after 60. Stripping the yolk away because of an outdated fear is a bit like throwing away the engine of a car because you're worried about the exhaust. You're discarding the very part doing most of the beneficial work. I want to tell you about a patient of mine, a retired accountant named Diane Ferro, 66 years old, from a suburb outside Sacramento, California. Diane had been eating egg white omelets exclusively for almost a decade, convinced this was protecting her heart. When we ran her labs, her HDL cholesterol, often called the good cholesterol because it helps clear excess cholesterol from your bloodstream, was lower than I'd expect for someone her age with an otherwise healthy lifestyle. We reintroduced whole eggs 3 to 4 times weekly alongside her existing habits. 6 months later, her lipid panel had genuinely improved, and she told me something that stuck with me. She said, "I spent 10 years afraid of the best part of the egg. For the fix, simply eat the whole egg, yolk included, unless a physician has specifically instructed you otherwise for a diagnosed medical reason." As a synergy tip, pair your whole eggs with a small serving of tomatoes or bell peppers, since the vitamin C in these vegetables enhances how well your body absorbs the iron naturally present in egg yolks. Mistake number 5 is eating the exact same portion of eggs every single day, regardless of your actual activity level, medications, or changing body composition. Many of my patients over 60 eat 2 eggs every morning purely out of habit, a routine set decades earlier, without ever reassessing whether that portion still matches what their body currently needs. Research on protein intake and aging consistently shows that older adults generally need more protein per pound of body weight than younger adults to combat anabolic resistance, not less. So this mistake usually isn't about eating too many eggs. It's about never adjusting based on your actual physical activity, your muscle mass goals, or other protein sources already present in your diet, which can lead to either quietly underfueling your muscles or unknowingly stacking excess calories on days when you're less active. This connects directly to sarcopenia again. Picture your daily protein intake like fuel deliveries to a series of small construction sites throughout your body, each one representing ongoing muscle repair. If the delivery truck brings the same fixed amount every day, regardless of how many construction sites are actively working, some days you'll have too little material to finish the job, and other days you'll have surplus sitting around doing nothing useful. The fix is to periodically reassess your protein needs, ideally with guidance from your physician or a registered dietitian, and adjust your egg portions alongside your overall protein intake based on your current activity level, any recent illness or recovery period, and your muscle mass goals. As a synergy tip, pair your eggs with a source of vitamin D, such as a few minutes of morning sunlight or a fortified food, since vitamin D plays a critical role in how effectively your muscles actually use dietary protein to rebuild tissue. Especially important because vitamin D synthesis in the skin naturally declines with age. Mistake number 4, and this is where the science gets more personal, is ignoring your own individual cholesterol response and assuming that because your neighbor or your spouse can eat eggs daily without any issue, you can too. Researchers have identified a distinct group of people called hyper-responders. Individuals whose blood cholesterol rises noticeably more than average when they consume dietary cholesterol, the kind found concentrated in egg yolks. For most people, the body compensates by simply producing less cholesterol internally when more comes in through food, keeping levels relatively stable. But for hyper-responders, that internal compensation system doesn't work as efficiently, and their LDL cholesterol can climb meaningfully with regular egg consumption in a way that wouldn't happen in someone else eating the exact same diet. This matters enormously after 60 because you may have spent decades eating eggs without any apparent issue, only to discover that age-related changes in liver function and lipid metabolism have shifted your personal response. The liver's ability to regulate cholesterol production can change with age, meaning a pattern that was perfectly safe for you at 45 isn't guaranteed to remain identical at 65. The fix here is straightforward and important. If you haven't had a lipid panel, a blood test measuring your cholesterol levels, in the past year, get one, and specifically discuss your egg consumption with your physician in that context, rather than assuming a blanket national guideline automatically applies to your unique physiology. As a synergy tip, if you do learn you're a hyper-responder, pairing eggs with soluble fiber sources like oats or beans in the same meal has been shown to help blunt cholesterol absorption, giving you more flexibility to still enjoy eggs in moderation. Now, before we get into the final 3 mistakes, the ones I consider genuinely serious, I want to pause for a moment. If this kind of straight-talking, research-backed guidance is useful to you, please hit subscribe and tap the like button right now. This channel exists specifically to give people your age accurate information instead of the fear-based headlines that dominate so much of health media. And every subscription genuinely helps this content reach more people who need it. All right, let's continue because mistake number 3 is one that I consider a genuine, avoidable danger, not just a suboptimal habit. Mistake number 3 is eating undercooked or raw eggs. Whether that's a soft, runny yolk you assume is harmless, homemade mayonnaise made with raw egg, or licking the spoon from raw cookie dough or cake batter, treating it as a nostalgic indulgence rather than recognizing the actual risk. This is where that immune system decline I mentioned earlier, immunosenescence, becomes critically important. Raw or undercooked eggs carry a real documented risk of salmonella contamination, a type of bacteria that causes food poisoning. In a younger adult with a robust immune system, a salmonella infection is often unpleasant but self-limiting, meaning the body clears it without major intervention. But in adults over 60, particularly those with diabetes, kidney disease, or any condition that further weakens immune function, salmonella infections are documented to cause more severe illness, longer hospital stays, and in some cases dangerous complications like bloodstream infections at meaningfully higher rates than in younger populations. Think of your immune system at 30 as a highly trained security team that can respond to almost any threat within minutes, overwhelming intruders before they cause real damage. By your 70s, that same security team still shows up, but more slowly, with fewer resources, and sometimes struggles to fully contain a threat before it spreads. That's not a reason for fear, but it is a reason to stop taking risks with raw eggs that your body could once tolerate without consequence. I think of my patient Harold Whitfield, 74 years old, from a small town outside Louisville, Kentucky, who ended up hospitalized for nearly a week after a bout of salmonella, traced back to a homemade Caesar dressing made with raw egg at a family gathering. Harold had eaten similar dressings his entire life without incident, and he told me afterward, with real frustration in his voice, "I didn't think my own body could turn on me over something I'd always been fine with." His recovery took weeks longer than it would have decades earlier, precisely because of that slower immune response. The fix is simple and non-negotiable. Cook your eggs until both the white and yolk are fully set. Avoid raw egg in homemade sauces or dressings unless you're using pasteurized eggs specifically labeled for that purpose. And skip raw cookie dough or batter entirely. As a synergy tip, if you're craving that classic runny yolk experience, look specifically for pasteurized eggs at the grocery store, which undergo a gentle heat treatment that kills harmful bacteria while keeping the egg raw enough to still run when you cut into it. Mistake number 2 is failing to adjust your egg habits around an existing diagnosed condition, most commonly diabetes dyslipidemia, which simply means abnormal cholesterol or fat levels in your blood, or chronic kidney disease. Here's something the general population headlines rarely clarify. Multiple studies have found that eggs appear neutral to beneficial for cardiovascular risk in generally healthy older adults. But some research, specifically in people with diabetes, has found a different, more concerning pattern, with certain studies linking higher egg consumption to increased cardiovascular risk in that specific population, a relationship not consistently observed in people without diabetes. Similarly, for those with chronic kidney disease, the concentrated protein and phosphorus content in eggs can require careful portion management, depending on the specific stage of kidney function. Why does this distinction matter so much for an aging body? When you already have diabetes, your blood vessels are often dealing with additional stress from fluctuating blood sugar, a process that can damage the delicate inner lining of your arteries, called the endothelium. Adding another variable, like dietary cholesterol, on top of an already compromised vascular system may behave completely differently than it would in someone without that underlying vulnerability. It's the difference between adding weight to a sturdy, well-maintained bridge versus adding that same weight to a bridge that's already showing structural stress. The load might be identical, but the outcome is not. The fix here is to never apply a blanket rule to your egg consumption if you're managing diabetes, kidney disease, or significant cholesterol abnormalities, and instead work directly with your physician to determine your personal, appropriate portion and frequency based on your specific labs and overall treatment plan. And now, mistake number 1, the one I teased at the very beginning of this video. The one connected directly back to that Monash University study I mentioned in the first 60 seconds. Mistake number 1, and the most consequential of all 7, is relying on eggs as a supposed health fix while ignoring the overall quality of the rest of your diet. Here's the detail from that Asprey study that almost nobody talks about. When researchers broke down the data by overall diet quality, they found that the protective benefit of eggs, that 17% lower risk of all-cause mortality and 29% lower cardiovascular mortality risk, was strongest in people with moderate to high overall diet quality, with those categories showing a 33% and 44% lower risk of cardiovascular death, respectively. In other words, eggs appeared to amplify the benefits of an already reasonably healthy diet, rather than functioning as a magic fix capable of offsetting a poor one on their own. This is the mistake I see most often in my own practice. A patient hears that eggs are protein-rich and good for you, so they start eating 3 eggs every morning. But the rest of their plate is dominated by processed, refined carbohydrates, minimal vegetables, and little fiber, and they assume the eggs alone are doing meaningful protective work. This connects back to that chronic inflammation I mentioned earlier. A single healthy food added to an otherwise inflammatory dietary pattern, one heavy in processed foods and added sugars, is a bit like adding one skilled firefighter to a building that's still actively being doused in gasoline elsewhere. That one person can only do so much good against everything working against them. I want to share one more story. A woman named Patricia Nguyen, 71 years old, from a quiet neighborhood outside Portland, Oregon. Patricia came to me convinced eggs were single-handedly protecting her heart because she'd read a headline online, while the rest of her diet remained heavy in white bread, processed lunch meats, and very little in the way of vegetables or fiber. Her inflammatory markers on her blood work were elevated despite her daily eggs. We didn't remove the eggs. Instead, we rebuilt the rest of her plate around them, adding vegetables, whole grains, and healthy fats, while keeping her eggs as a genuinely valuable piece of a now much stronger overall pattern. 8 months later, her inflammatory markers had dropped meaningfully, and she told me, "I thought the egg was supposed to be the hero. Turns out it needed a supporting cast." The fix is to stop viewing any single food, including eggs, as an isolated solution, and instead build a genuinely balanced plate around them, rich in vegetables, fiber, and healthy fats. As a synergy tip, pair your eggs with a source of fiber like whole grain toast or a side of berries, since fiber has been shown to support healthier lipid metabolism and may help further optimize how your body responds to the cholesterol naturally present in eggs. So there you have it, all 7 mistakes, counted down from the mildest at number 7, always frying in heavy fat, to the most consequential at number 1, treating eggs as a lone health fix while neglecting the diet surrounding them. Along the way, we covered skipping the yolk unnecessarily, never adjusting your portions to your changing body, ignoring your personal cholesterol response, the very real danger of undercooked eggs given a slower aging immune system, and the critical importance of tailoring your habits around any existing diagnosed condition. I want to leave you with something beyond the science, because after decades of practicing medicine, I've come to believe that questions like this one, about something as ordinary as how you eat an egg, are really questions about something much bigger. They're about whether you get to keep doing the things that make your life feel like yours. Cooking breakfast for a grandchild, traveling without anxiety about a hospital visit, waking up with energy instead of dread. None of the 7 mistakes we covered today require you to fear eggs or give them up. They require awareness, a willingness to adjust old habits to match the body you actually have today, not the one you had at 40. And I want you to hear this clearly. It is never too late to make these small adjustments. Not at 65, not at 75, not at 85. Every single change we discussed today can be started this week, and your body, remarkably, remains capable of responding to that care, no matter how many decades you've already lived. If this video gave you something genuinely useful, please subscribe to this channel because I'm creating more content just like this, grounded in real research, specifically for people navigating their health with clear eyes in their 60s, 70s, and beyond. And before you go, answer this for me in the comments, and remember, I read every single one. Which of these 7 mistakes did you recognize in your own habits? And which one are you going to fix first? I'll see you in the next video.